My name is Dr. Kelley. I am the founder and medical director at CASE Integrative Health in Chicago. We deal with mostly chronic Lyme as well as other chronic complex mystery illnesses in our practice from an integrative and functional medicine point of view. So I was very active growing up in Ohio. I was in sports and dance and musical theater and all the things. And I got to college and all of a sudden I had a hard time walking up the hill to my dorm. I got really short of breath and really winded. I couldn't exercise. I couldn't do all the things I used to do, which was really frustrating for me. I saw doctors. I got diagnosed with asthma, which is definitely not asthma. And in med school, I started having even more problems. Did get diagnosed with ADD along the way. Told I didn't need medication, but that I had some focus issues. And then I started, when I had to be in the rounds and be in the hospital on my feet all the time, really just struggling with dizziness, fast heart rate, trouble paying attention, and extreme fatigue. Actually got myself diagnosed with POTS, postural orthostatic tachycardia, which is pretty common with tick-borne infections, which I did not know that at the time, but it just kept coming back. It kept coming back like, this fatigue, the POTS, all these things might be related to a tick-borne infection. I eventually got myself tested, and it was positive. Big surprise. And so I got through my own healing journey of treating that. And I went through the whole rigmarole. I did antibiotics, I did herbs, I did IVs, I did the whole thing. And, my life changed. I got a lot better. I am on faculty at Northwestern's medical school through the family medicine department. And right now I'm working with their PA students. So we have PA students that rotate in with us. They're usually here for about a month at a time, and they get to sit in on our patients. Through that, I get to also teach about Lyme, because most of my patients have Lyme, and so I get to open that up. Some of the students have heard of it, some of them know a little bit, some have no idea what it is. They're not getting that education, the depth in their schooling. There's a lot of things that are lacking in our education about these infections. In my medical school, it was very glanced over. It was, you get a tick, you get a rash, you get 2 weeks of meds, you're done, moving on, kind of thing. And there wasn't any other talk about it that I can remember. That just wasn't a big thing. And so there's very little education about it, at least back in the day when I was in school. We have definitions for chronic Lyme disease now in scientific papers and this. We have this that we can be teaching our students so that they're on the lookout for it, and so that they're asking why people have, these symptoms, so that it can be caught early and treated early, because that's when the victories come. The doctors aren't being taught about what a Western blot is, what it means, how to interpret it. We're just being taught the CDC's 2-step testing, which is for surveillance purposes. It's not for diagnosis. It's to put a pin on a map to show where an infection is. It's not to actually diagnose patients. So we need to be teaching our doctors of these different infections, because it's not just Lyme. There's anaplasmosis, there's ehrlichiosis, there's Rocky Mountain spotted fever. There's a lot of infections that get transmitted that get overlooked in the chronic stages. When I educate providers, I will call out the CDC's website. It says it right here. It's a clinical diagnosis. Full stop. Such a victory when it's like, yes, there's a rash, here's your meds, you never get treatments, like your tests are always negative, like this is a victory, like this is not an issue. But that requires, the doctors to be educated and the parents to be educated as well on what to look for and how to advocate for their kids. So a clinical diagnosis is a history and physical exam. You sit down with a patient and you ask a whole bunch of questions, and for chronic patients, it can go all the way back to birth and childhood. How exposures and possible exposures and illnesses and other issues that they've had since childhood, even maybe before their current set of symptoms started. And then a physical exam. So there are certain things that we can kind of look for that might show us that they're more likely to have a tick-borne infection. So you do an exam and you look for those things. And so that's what's considered a clinical diagnosis. You don't have to have the lab work. The lab work is supportive. In an acute infection, you just got a tick bite, the labs aren't going to be positive anyway. It's too soon. So you have to do a clinical diagnosis. So you really have to jump on it, especially if they have the rash or a suspicious rash, even if it's not the perfect bullseye rash. with a headache, flu-like symptoms, joint pain, fatigue, you got to start them on treatment right away because it's clinically diagnostic of Lyme. There's an acute issue, an acute infections and issues. If we can deal with that in that initial stage, we're going to have better outcomes. But it also needs to be taught that there's chronic stages as well. And it's more than just a post-treatment Lyme issue, because that is a thing and that's one thing we have to learn about. But the other part are the chronic lingering self-infections. Doctors can be taught this. We know this for things like tuberculosis. You know, we're taught about all of that and how someone gets tuberculosis, they instantly get 9 months of medicine, at least, you know. So doctors can be taught that these things exist, right? We know about this in our models already. I think one of the biggest hurdles for the recognition of these chronic illnesses is really good testing, not necessarily this definitive black and white, you know, laboratory test that we can do. That makes it really hard for some of the conventional docs to fully embrace the infection. That's not to say that there's not a plethora of scientific information and data proving that chronic Lyme exists, but that just kind of goes in one ear and out the other, because it's not just like, you know, I test this and it's positive and then I can treat it kind of thing. I think that that's a big hurdle. It's just, a lot of it too is an awareness issue. So medical schools in Connecticut are teaching more about it than medical schools in Ohio. That's the $1 million question right there. And this is where it gets really, really tricky too. And years of experience does help with this, because all of these symptoms for all these different illnesses tend to overlap. So there's definitely clinical pearls that we'll look out for when we're trying to gather that history. Certain little things that will ping my brain that make me think about one thing versus another. Although usually it's multiple things. So it's not just one infection. And the other thing I will tell providers is, you know, in patients, if you're going down one route and it's not working, you've got to stop and reassess and figure out what you're missing. There are other immune dysfunctions that are the culprit, not the infections. So you always have to be able to go, stop, where are we? Why isn't this working? How do I make this work? And reevaluate. Be open and pay attention to all of those nuances that come along. You know, it's a slippery slope, because we can refer out to specialists, and the specialists here, they have Lyme and they laugh them out the door. So that's also not helping them get the help that they need when the other provider won't even take them seriously because they have a diagnosis of Lyme disease, which is just, it's heartbreaking, right? But it happens every day. And I also try very hard to take my blinders off and not have the opposite issue, because I have seen other Lyme doctors, you know, leave their blinders on and everything is Lyme, you know, and it's not. There's a lot more to these complex medical problems. So you also have to go, okay, you know, I need this patient to get worked up for their CIDP. So, you know, that may or may not be related to Lyme, but it's also another issue at hand that we have to deal with separately, together with all of these things. So you have to be able to go, okay, what else is happening? I really do truly want to believe that doctors are doing the best that they can with the information that they have. But if they're not the right doctor, if they're not helping you get the answers that you need, you need to go advocate for yourself and find somebody else. You're sick, but you don't look sick, and you're sick with something that people don't understand. So when your doctor doesn't acknowledge that there's something going on, your family won't acknowledge that something's going on, and all of this gets extremely isolating and, quite frankly, depressing to try to fight through that. It's a full-time job to have one of these chronic illnesses. Keep focusing on the good side, the positives, the healing aspect of things, and you will get better.